At JCK Hospital, we understand that a child's smile is priceless. That's why our
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that's healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Most men and women walk into a doctor's office during pregnancy to monitor the well-being of their baby. Now, that happens for the pregnant women until something is unveiled about an underlying condition that the mother is suffering from. But think about this. Non-pregnant women don't get that chance until later in life, when a symptom denoting a serious health condition appears. Now, what if what you need today is not a fat-burning pill, a blood test, but rather a pelvic ultrasound? Now stay tuned as we uncover the vital role a pelvic ultrasound plays in early detection and fighting against reproductive health issues. Greetings and welcome to yet another transformative episode of the Healthy You program. Now this is your favorite health program on Faith Today Television. My name is Enock Kitondekijja, your host. Now a special thanks goes to JCK Hospital. They make this program possible. Should you be interested in any health service, emergency services, they are right there at your service. Now, you can reach them using that number on your screen. You can also find them in Roysambu along Lumumba Drive, just next to Park University. Great. Now, today's topic is one of those discussions that we should have had earlier. We are talking about pelvic ultrasound. There are some of important scans that you should not miss out. Last week, we onboarded a discussion trying to unveil special scans that you do not want to miss during pregnancy. Today, rather, we want to now onboard every woman out there. There are certain scans that you do not want to miss. And to help us unpack this discussion is a seasoned sonographer who also doubles as the lead radiographer at Kitondekijja Hospital. She has an experience of more than 4 years in the field. But before I invite her to take us to the next level, I'm aware of those of you who follow us on social media. Please remember to like this discussion, follow us, and if it makes sense, go ahead and share with as many people as you can. Thank you so much. Back to my guest.
Hi.
Fiona, you are welcome.
Thank you so much. Hi and good morning. My name is Fiona Khaemba. I'm a radiographer, I'm a cardiac sonographer, and I'm so glad for this opportunity to be here again today for us to indulge more about the pelvic ultrasound. Thank you.
Welcome to have you once
Asante.
again.
Thank you so much.
How has your week started?
The week started on a very high note. We are doing work. We are doing a lot of cases, emergencies and all that, but we thank God for it. We are well, yeah.
You're doing well.
Yeah.
We're happy for the work you're doing for the community, and I'm sure you are touching lives.
Yeah, sure. Thank you. So
today we have you on board to help us now expound on a subject that probably some women thought there are certain tests we do that are not only for the pregnant women.
Yeah.
But today we want to talk about the pelvic ultrasound.
Yeah.
And we want to begin with clarity. If you would help us define what it is and how it differs from other tests that you usually do.
Yeah.
Yes.
So today we are doing the pelvic ultrasound, and basically a pelvic ultrasound is more of an ultrasound of the organs of the reproductive system on the females. And it also covers the male, but male it's not more of the reproductive organs, but it covers the prostate and the bladder for the men. But when it comes to women or rather ladies, we cover the whole reproductive system, all the way from the uterus to the ovaries, to the fallopian tubes, to the cervix, to the urinary bladder, and everything else that entails the female reproductive system, it's covered under the pelvic ultrasound. So ideally a pelvic ultrasound, it's a scan that it's used to go through to peruse the female reproductive organs. Yeah.
So you navigate the entire reproductive system?
Yes, yes.
And help us understand what is going on in there?
Yes, yes, yes.
Okay. So also to help us understand, after you getting to understand whatever is happening in there, what conditions do you usually pick in a pelvic ultrasound?
So for a pelvic ultrasound, there is a wide range of conditions that can be picked. Number one, we can find fibroids. Fibroids are tumors or rather growths that implant themselves in the uterus, and they can be seen during the pelvic examination. We can find the ovarian cysts. These are sacs that are filled with fluids that usually grow on the ovaries or on the adnexal region, both the right and the left adnexal region. You can see them during the scan. You can measure, you find how big they are or how small they are. You can find if they're having any abnormalities. Maybe you can find sometimes the ovary, it can twist, and then it causes a lot of pain on ladies. So it's called an ovarian torsion. It's usually seen on the ultrasound. And then you can see there are some infections that usually occur. Maybe someone had an STI and it went untreated. So there is an infection that comes, it's called a pelvic inflammatory disease. In brackets, we call it a PID. So it's usually seen in the ultrasound because it usually affects the organs. So it settles on the lower pelvic, on the lower abdominal part. So when you do the ultrasound for the pelvic, you get to see there's some fluid in the pouch of Douglas. That's when you know we are having a PID case. We can also see endometriosis, but not fully. We try and help rule out endometriosis because when you see the lining of the endometrium is outside, it's not inside the uterus, that's a red flag. That's a sign that there could be a possible endometriosis. So we help the doctors to diagnose more, to correlate with other tests so that you can be able to rule out the endometriosis. We also have people who have painful menstruation. When you experience painful menstruation, you can come for the scan. We get to rule out what exactly is causing the painful menstruation. And then when you come to the bladder, we are able to check the bladder stones. We're able to check the lining of the bladder, whether it's thickened or not. So we are able to rule out whether we are having a bladder cystitis or not. That is on females. When we are checking on a pelvic ultrasound on male, we majorly concentrate on the bladder and the prostate. So for the prostate, we are able to see whether it's enlarged. We're able to see whether it's having any masses, whether it's having any abnormal growths. We're able to check the size, and we're able to check the echogenicity to check whether it's a functional prostate or whether it's enlarged. Yeah.
Wow, I love the details. And for our viewers, you can tell this discussion is not just precluding, it's not just concentrating on the female.
Yeah.
I see you're giving more information for the male. So for those of you who thought this is just for one gender, please share this discussion with your family members. You have a brother, a father, a relative who needs this. It is inclusive. You don't want to miss it. We are learning that what they are really checking for is any kind of abnormality within your reproductive system. She has highlighted fibroids, cysts.
Yeah.
She has talked about PIDs, that is pelvic inflammatory disease, an infection that happens in the inside there in the females. And then she has also onboarded now the male gender. Yeah, they get to analyze your bladder, they get to look at your prostate. So this is a very important procedure, right?
Yeah, sure, very important.
Very important. So you don't want to miss this. And probably, Fiona, you can also help us understand at what point or when should someone do, is it a routine test that should be done? Is it something that someone has to walk in? When should someone do such a test?
Okay, for pelvic ultrasound, you can walk in to get a pelvic ultrasound. That's when you just need a routine check. It's not necessarily means that you are sick, but you can just walk in to get checked. You can see a doctor, and then the doctor will recommend the test for you. That is maybe if you're having painful periods for the ladies, if you're having vaginal discharge that is weird, that is smelly, you can walk in, the doctor will recommend the pelvic scan. If you're having abnormal bleeding, like maybe your menstruation is very irregular, or you just bleed out of nowhere and you're not on your periods, you can come get checked to find out. Maybe it could be fibroid, because fibroids present themselves with bleeding and abnormal discharges, and you have this painful cramping, excess cramping. Cramping is not bad because it happens to some people, but when it becomes excessive, that's a red flag and you need to get checked. And also you can get checked when maybe you've been treated for a urinary tract infection, UTI, and it's been occurring back to back. You treat, after a few months or a few days or a few weeks, it comes back. You need to get checked for the pelvic scan so that you can be able to rule out what is really happening inside the reproductive organs. Yeah.
So what you're talking about today, you are reminding people who usually get treated for a UTI over and over again.
Yeah.
You know, there are those who even now know what drugs to take. Whenever they have a simple UTI, they know the doctor will recommend this. They take the same drug. After some time, they get well, and then it comes back.
Yes.
So what you're trying to mean is that there could be another underlying issue that is happening in there that we shouldn't take for granted.
Yeah, you shouldn't take for granted. And maybe to add on it, if you're having children who are ladies, who are girls, once they start menstruation, you can just bring them for a routine check, just to check if everything is in order. That's advised. Not necessarily when they're sick. You can just walk in and get checked.
Okay.
Yeah.
At what age preferably?
You see, for menstruation, it usually varies. But once a girl becomes a teenager, they can come.
They should come.
For the scan.
Well, that's a very great insight.
Yeah.
And I'm learning something here, because when you talk about fibroids, for some women, there could be no any signs or symptoms to show.
Yeah.
Because when you look at the research, it shows that 80% of women will develop a fibroid by the age of 50.
Yeah.
So at what point really should a woman, even though they missed it during their earlier years, get this scan done? Yeah.
Okay, for a woman, maybe they've had fibroids and they didn't know. You see, fibroids, they grow. You can have a pelvic scan done today. You get the fibroid, maybe it's around 3 centimeters. After 4 months, the same fibroid will have grown to around 10 centimeters. It's something that grows. And the more bigger it becomes, the more the symptoms it predisposes. Like you can get this person is having bleeding, excessive bleeding. Maybe they are past 45, so they are not supposed to have periods. They are post-menopause, but they're still having bleeding that sometimes comes with a lot of clots, big clots. Or you can see that this person has, the abdomen is swollen, it's bloated. They're usually complaining of bloated. Or you might think they are pregnant, but no, they are not. It's because the fibroid has enlarged in size. So whenever you have such a case, as soon as you start seeing those symptoms that are predisposing themselves and they're not normal, you can just come for the scan. It's never late for the scan. I know early detection helps to know the way forward, but also when you come in late, you'll still get help. Maybe you'll be scheduled for surgery. Maybe the doctor will tell you they'll shrink on themselves when they are still young, but you just need to get checked. Do not fear because the time has gone or because you feel it's too late. You just have to come and get checked. Yeah.
All right. Thank you so much, Fiona. For our viewers, what we are learning today is that you don't want to take any chances. As soon as your daughter, your sister has reached menstrual years, it's important that you do a pelvic ultrasound. This is what we learn. And for the adults, we get to learn today that whenever you feel or see something abnormal, that is the time that you should go and check, because some of the fibroids he talks about, they are not painful, You can just see, an enlarged tummy and you think this is just another fat in there. You should do away with a fat burning pill, yet it is something serious. So it is important to do this scan.
Yeah, it's important to do the scan.
Okay.
Yeah.
And maybe also help us understand, why is the pelvic ultrasound so special? Some women get the chance to do a scan, but there are those who don't even get the chance.
Yes.
What can be picked from a pelvic ultrasound and cannot be picked during an obstetric ultrasound?
Okay, an obstetric ultrasound majorly concentrates on the baby. Okay, when a mother is expectant, a good part of the uterus, the majority of the uterus is occupied by the fetus, that is the baby. So we are limited to see many of the organs, especially when the pregnancy is maybe in their 2nd or 3rd trimesters. So for a pelvic ultrasound, we will pick every organ. We will pick the measurements. Is this ovary in the right measurement? Is it in the right size? How is the volume of the uterus? How is the porch of Douglas? Is it having any fluids or not? We are able to pick very specific details on the pelvic ultrasound that we are limited to pick them on the obstetric ultrasound unless the pregnancy is below 12 weeks, is when we can clearly see the ovaries, or we can clearly see the adnexal region or the porch of Douglas, or we can clearly see the bladder. So for a pelvic ultrasound, an early pregnancy can be detected in a pelvic ultrasound. We shall see whether the pregnancy is 6 weeks, whether the pregnancy is 10 weeks or 12 weeks. But above from that, we consider it an obstetric ultrasound. So for a pelvic ultrasound, it's very keen to details compared to the other obstetric ultrasound. That's what makes it very special. And then to add on it, for example, we are dealing with a case of fibroid. When a mother is pregnant, we are not really able to capture the full measurements of the fibroid, because you see the fibroid implants in the uterus, the baby implants in the uterus, so they can be
by Jessica Hospital. Just here, your neighbors in Roysambu, you can meet them along Lumumba Drive. And in case you need any specified information, you need consultation, the team is really loaded. They are right there at your service. Use that number to reach them. Fiona,
yes.
I'm getting quality information today, and I'm sure our viewers are also gleaning the same.
Yeah.
And of course, to remind our viewers, in case you have any question for our doctor here, yeah, make sure you send it as soon as possible. As soon as you see that number of hours on the screen, use it to send in your question so that you get attended to right away. I know there are people who have fears to do with this kind of scans, and we want to hear your program or your process of how do you prepare these people, what should they expect, at what point does someone go to get this pelvic ultrasound. You know, ladies also are very complicated in a way,
Yeah.
so you need to let us know at what point, what do they need to prepare, for this scan.
Okay, that's a good question. For fear, that is something that we've had to deal with severely, because you see, there are people who struggle with conceiving. There are people who've had issues to do with infertility. Maybe they've done an ultrasound at some point, they were told we are having fibroids. Or you go to the next point, they tell you the fibroid has increased in size. The next person tells you not only have the fibroid, you also have cysts. So you see, this person has developed fear in their mind. So you get this patient, she has gone through several ultrasounds, she already knows what she has. So maybe she has that fear of, maybe you'll tell her she has another thing, or maybe something will be found again during the ultrasound. So for such patients, you just offer them moral support. You reassure them. Actually, it's more of reassuring them, telling them that yes, you have fibroid, but that is not the end of it all. It can be corrected. Or maybe you have blocked tubes. That's why you're dealing with infertility. Because you see, someone who's been trying to conceive for a long time, that person is so frustrated. And most of the time they develop that fear. Most of the time you feel like they're so down. They don't even to have any interaction during the scan because they feel maybe that's the end of everything. They're having pressures to get babies and all that. But you have to reassure them. You have to tell them that some things, they can be corrected. You have to tell them that you can conceive even with one tube. It does not really mean that you need to have both tubes, the left and the right. You have to give them maybe examples of things that have happened. Maybe people have conceived with fibroids, or people have carried their pregnancy to term when they had cysts. Yeah, you just need to give them moral support and to keep on reassuring them. Yeah, and to advise them to keep on coming for the clinics, maybe to see the gynecologist, so that they can give them some light or a heads up on how things are supposed to be done and to be handled.
Okay.
Yeah.
So you are trying to emphasize that moral support is important, even for your colleagues that you work with.
Yeah.
Something that you guys really pay attention to.
Yes.
That's very important.
Yeah, very.
For our viewers, I'm sure there are those who could wonder, they walk into a doctor's office or your office, and they are told to drink water. What does that mean?
That's also another preparation for a pelvic ultrasound. You're supposed to take at least 10 glasses, 8 to 10 glasses of water. The main goal is to have a full bladder. When we have a full bladder, we are able to see clearly, because the organs will project themselves more clearly. The clarity will be there when we are having a full bladder. We'll be able to rule out a lot of things. Okay, we have those who cannot take the water, who cannot do 10 glasses. Maybe they take the water and they end up vomiting, or they end up getting nauseated. We have another scan, a substitute for pelvic ultrasound. We call it a transvaginal scan for ladies. And for men, we call it a transrectal scan. That can also be effective in doing the pelvic organs, to check them out and to rule out. So majorly the preparation for taking water, it's usually for clarity, to help us see well. Because once the bladder is full, it's well distended, you get to see clearly. The organs project themselves very clearly. Yes.
So that is why you let our patients take water.
Yes, we let you take a lot of water.
Okay.
And
so
to have a full bladder.
You can see clearly.
Yes.
Okay. There are those who are also interested in, because when people are busy, 21st century, people get to work and do. Can they take this water before they come to your clinic, or do they have to take it there and then when they are in your spaces?
Okay, actually there are those who know the rule for a basic ultrasound. For a pelvic ultrasound, it's to take water. So they come when they're fully prepared. They start taking water on their way, or they take water at home. They come. Wherever place you take the water, the goal is to have a full bladder. So once you come and say you have a full bladder, we can do the ultrasound. So it doesn't matter whether you take it at home, whether you take it at the facility, whether you take it on the way. The goal is to have a full bladder. But then you're not supposed to, maybe you take it at home, you stay far, or you take it at work and then the work is far. You have to hold that urine until you get to the hospital. Maybe you get it's not advised to hold urine for so long, because that can be a cause of bladder cystitis. So in as much as we are taking water, we need to be careful. Like, you should not hold urine for more than 40 minutes. You're holding urine because you're coming for a pelvic ultrasound. So you need to apply those measures. You calculate, when am I getting to the hospital? Is it more than 1 hour? It's not worth it for me to take water and hold urine. So in as much as you're taking water, actually it makes our work easier. When you come, you say you're full, you are ready for the stand, but also remember to take the precaution. Yeah.
And I think we needed to hear that.
Yeah.
Very important, because when you talk about now cystitis, that is another condition coming in.
Yes.
That is inflammation of the bladder, right?
Yeah.
Okay, so I know we are going to take a short break, but before we take that break, I know questions are also coming in. There's that one person who is not yet answered, I believe. I feel someone who is asking, like, what difference does it make in terms of reproductive health? A scan, that you call it the pelvic ultrasound.
Pelvic ultrasound,
Yes. In terms of reproductive health, what difference does it make?
It makes a lot of difference, because when you're able to diagnose something, the early diagnosis, the better. You help us to know how to handle you. The doctors will know how to handle you before things get out of hand. Things like infertility, there are things that can be identified early. Some successfully, they get reformed. Some others, unfortunately, they don't. But early detection will always help the doctors to know early diagnosis and how to help you and how to enable the thing that has been diagnosed to disappear. So early detection is equal to early treatment is equal to getting well.
So in other words, we want to conclude by saying this first part, that early detection is equivalent to
Early diagnosis.
Early diagnosis,
Yes.
which also translates to better outcomes.
Yes.
Better outcomes.
Yes, better outcomes.
All right. And I know she has a package here for us in terms of now, how do we prevent all these conditions? She has talked about fibroids, she's talked about cysts, she's talked about PIDs and a lot. So you would want to understand what is the way forward. You know, much as these conditions are happening all over, but there is a preventive strategy that you needed to know. So we are going to take a short break, and when we return, we are going to answer that and also get to answer your questions. So do not go any far. Catch you in a few.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Hey there, welcome back once again to our second segment of pelvic ultrasound being unmasked. Today we are talking about a very sensitive issue that is onboarding every woman out there. We are learning from the expert that there are certain conditions that cannot be picked during pregnancy. They need, when there is nothing interrupting or in the uterus, so that the experts are able to tell whatever you are suffering from. We're also able to learn that some of these conditions do not present in a painful manner until when a scan is done. That is when they can tell. So you don't have to wait until you have all these exaggerated symptoms or presentations that might risk your reproductive health, or by extension, your health in the long run. So we have an expert here from JCK Hospital, again, our esteemed partners. We want to recognize and emphasize that the first people who are emphasizing health for the body, mind, and soul. So it's important to walk the journey with them. And that number on your screen, contact them and you get sorted. Fiona,
Yes.
I'm enjoying the discussion and I'm learning a lot.
Yeah.
And earlier you talked about a certain term that I believe our viewers would want clarity on.
Okay.
You spoke about transvaginal ultrasound, and then there's a transabdominal ultrasound.
Yeah.
Could you help us make the difference and also what is involved in now in the pelvic ultrasound?
Okay.
I remember you also talked about the one for the men. Is it the transrectal ultrasound? What's the difference? And which age group is catered for in those three types of scans?
Okay. So we have all of them are focusing on the pelvic organs. So we have a transabdominal scan. That one is a pelvic scan that is done on the surface of the abdomen. We are seeing the organs from the surface, from the abdominal side, on your tummy or below your tummy. That's how we call it a transabdominal scan. We have a transvaginal scan. That's also an ultrasound of the pelvic organs for the females, for the ladies, and we usually do it through the vagina. We have a special type of probe that we use to use it through the vagina. So this probe is usually a condom is usually inserted on it, and then you go in through the vagina to get more clarity on the organs. Or rather, it can be helpful for those patients who are not able to take water, or they are nauseated, or they keep on vomiting when they take water, or they take water but they cannot be full. They don't feel full. It can also be used in tracking the follicles for those who are following up on getting pregnant, counting the number of follicles that we have, the active follicles. That's the use for transvaginal ultrasound. We have cases where a patient is told that they're having an ectopic pregnancy, but it's only the transabdominal one that has been done. So most times the doctors usually ask for a second opinion using the transvaginal scan because it's more accurate and it's more keen to details compared to the transabdominal. I'm not saying the transabdominal is bad, but there are cases where we really need the transvaginal ultrasound. So for this transvaginal ultrasound, it has its limitations. And number one, it cannot be done to, let's say, ladies who are below 16. Okay, let's say to those who are not virgins, it can be done. But to virgins, we cannot do it to a virgin. We do a transvaginal to a virgin. That is not possible. So that's for the transvaginal. For the transrectal, it's usually done for men. That is when we usually want to concentrate on the prostate. We want to know the echogenicity of the prostate. We want to know the size of the prostate. Or someone who is having hemorrhoids for men, also for women. Transrectal is for both men and women, to rule out hemorrhoids, to know the number of hemorrhoids that are there, to know how big they are, if they are bleeding or not. We do the transrectal. So for the transrectal, the same probe that is used for the transvaginal, it's also used for the transrectal. But now we do it through the rectum. Yeah. Safety measures are taken to ensure infection prevention is maintained, so no one should have fear or develop fear on the transvaginal or on the transrectal ultrasound. Yes.
I like it when you add the disclaimer because that answers the question I was about to ask again.
Yeah.
Because we need to be cautious about infections,
Yes.
transmission.
Yes, yes.
Someone should not get them from the hospital.
Yeah.
You know. So what we learned today is that the pelvic ultrasound is a bit general, but now you get to narrow down to now the specifics that help you get the details.
Yes, yes.
For our viewers, these people are able to get the details. There is no doubt they are able to diagnose your issue when they do this extensive procedure. So it is important to trust what they do. It is important to come, get tested. We also know that now there's a certain age group, probably the young ones who do not qualify for the transvaginal, you know, because that is when they are able to now get the details of the reproductive organs in there so that we can be able to diagnose your issue and help you. This is very, very helpful information.
Yes, yes.
And I believe it is very timely for our women out there. You've also added in now the men. It's important.
Yeah, the men, for everyone.
For everyone.
Yeah.
All right. You talked about now something that I think in the future I'm going to engage you on about a PID. But before I do, I want to do justice to our viewers. Again, thank you so much for catching the Healthy You program. I hope you have subscribed. That is the only way we can support. You can support us, I believe, and then also partnering with this movement of transforming people's health. You can support this program. You can support this television. There are tires that you will be seeing running on your television. So that we are able to reach more people. So I get questions coming in. The first one didn't add the name, but remember to send in with your name and where you are watching from so that we can help you better. Hi, this one said, hi, this is Rose. Oh, yes, Rose. Is it safe to have many ultrasounds during pregnancy?
Oh, hi, Rose. Thank you for catching up in this conversation. Yes, we had said it last time and I will say it again. Ultrasound scan is very safe because we are using sound waves, so it's non-invasive. We are not using radiation. Yes, it's very safe to do ultrasounds during pregnancy. No matter how many, it's normal and it's very safe to do the ultrasounds. And yes, I can confirm to you that ultrasounds are safe during pregnancy. They don't have any harm to the mother. They don't have any harm to the baby. So it's very safe. Do not be worried. Get them done.
Okay.
Yeah.
I think that answers so many questions because people go for massages, but they fear to go for an ultrasound. And we get to hear that it is rather safe. Thank you so much. We have another question coming in from, she didn't put the name. Are there things an ultrasound cannot detect in pregnancy? Are there things an ultrasound cannot detect in pregnancy?
Hi, yes, there are so many things an ultrasound cannot detect on pregnancy because our focus is on the baby. And for the baby, as I highlighted last time, we are checking on the baby's weight. We are checking on the baby's cord around the neck or not. We are checking on the baby's biophysical profile, how they are breathing, whether they are having movements, whether they have developed all their organs. We are checking on the amniotic fluid, the volume, if it's enough for the baby during the weeks that they are in. We are not able to check the baby's color. We are not able to check the hair of the baby. We are not able to check like some things. You see, there are some babies who can be born with 6 fingers. We cannot see that on ultrasound, but we can see the general health of the baby. We can see if there are any abnormalities that the baby might be having so that they can be rectified or they can be handled when the baby is born. And then there are things like maybe you're having a mother is positive, HIV positive, maybe or not, the baby could be. So that cannot be seen on the ultrasound. That needs for the baby to come so that they can be tested. They can be done, the lab tests, they can be done, be able to rule out some anomalies, some infections concerning the baby. So majorly we are seeing the structural abnormalities or the structural things that are normal for the baby. But when we go down to infections and diseases, that will wait for the lab tests to be done. So the baby needs to be born first.
Okay.
Yes.
I think that answers so many questions because now justifies now the other parties, you know. So ultrasound does, there are things it does, and then there are those that the blood.
Yes.
Yeah, the blood tests help reveal.
Yeah.
That is very, very helpful. We have another one. This is Naomi. Naomi, thank you for watching the show. She says, good morning. Love the conversation. Can a pelvic ultrasound show problems with fertility?
Hi, Naomi. Yes, the pelvic ultrasound can show problems with fertility. We started by highlighting the fibroids. Fibroids are they contribute a lot to infertility in women. So we can be able to identify fibroids. We can be able to identify the PID. PID is also a threatening factor when it comes to fertility. When you're dealing with fertility, people who have PID or fibroids, they usually struggle with fertility or miscarriages. Once they get pregnant, you see there is a series of miscarriages that follow. And then we also to determine, you see with fertility, we are going down to menstruation, to periods. We're able to track down your periods and your follicles. We're able to track down the active follicles when you're ovulating. We're able to track down the number of follicles that you're having, if they are enough for the required ones to get pregnant. So yes, a pelvic ultrasound, or rather a transvaginal ultrasound, can be a very important factor when you're dealing with fertility because it helps us to get a lot. And also we're able to see the cervix. Most of the times we find we could be dealing with a cervix that is so incompetent, or the cervix is out of shape, or the location of the cervix, whether sometimes it's posterior or at the far end. So when you do the ultrasound, you can be able to assess the cervix to know, because the cervix is the leeway where the sperms will get through. Sometimes they miss because of the location of the cervix. So we are able to see clearly and to diagnose, to help the doctors diagnose the key factor that could be leading to the miscarriage. We can see the blocked tubes. The blocked tubes, you will be told to go for another special examination called a HSG, hysterosalpingogram. It is able to unblock the tubes that are blocked, whether bilateral blocking or one side is blocked, we are able to see. And there are those that can still do the HSG, and we find that both tubes are blocked and none became unblocked. So it gives us a heads up on doing when we are dealing with the infertility, because it's a very wide thing we get to experience every day, because people are looking for kids every day.
Yeah. Every day.
Yeah, every day.
Every day. So she says, if you are in the struggle or the attempt of trying to get a baby and you are probably not getting through, she says the opening of the reproductive canal, the cervix, could be inverted, could be in the wrong places. And so it's important to ascertain that what they do help you get to know whatever you are dealing with, so that they can suggest, the doctors can suggest the course of action. This is just very quality information.
Random shop of the meaning of the PID that has been there. So for PID, first of all, it's cleanliness, like your hygiene. You just learn how to handle your hygiene because it affects ladies. Learn how to handle your hygiene as a lady. You can change your pants. You can stick to one sexual partner if you really need to, or you can use protection when you're having sex, because unprotected sex usually leads to PID most of the times, to transmission of PID. And then you can also find that using of the public toilets, you need to be really keen, because PID is something that transmits very quickly to people. So basically sticking to one sexual partner, watching on your hygiene. If you have multiple sexual partners, you can use protection, you can use condoms and all that. And then you can be very keen when using the public toilets in public facilities. You can air out your innerwears. You can change them regularly. Maybe after a short period of time, you change them. When you notice abnormal things, when you notice discharge that is not normal, you can go to the hospital. You get tested to the lab. You see what infection you're dealing with. You can sometimes avoid the over-the-counter drugs, because you see most of the times we've developed the habit of, I'm having an infection, let me go get an antibiotic. But you don't really know the type of infection that you're dealing with. So those are some of the safety measures that can be used to avoid the PID. Yeah.
Safety measures to avoid PIDs. And you can tell she's giving general information that should help a broader graphic, but also now for faith-based television and our background, we believe that believers need to stick to one sexual partner and you be faithful. That's very, very important, because some of these things we learn from the church space and we don't know that they help us a long way. They really go a long way. So I hope you get that information in there and watch your health. Watch your health. Sure. Health is wealth. And that is coming in from our expert here, Fiona, from again JCK Hospital. All right, so many questions are coming in today, and again I want to remind you, if you've not yet subscribed to Faith Today Television, please go ahead and do that today. And then if you have any question, again we are able to answer you. Send in that comment. If you want to support, you can also support us. We will welcome that. Someone is asking here, I think we answered this one. This is Jen in Githurai. Is there a difference between pelvic ultrasound and abdominal ultrasound? You answered that, right?
And pelvic and abdominal.
Pelvic and abdominal ultrasound.
We didn't answer that.
Oh, we didn't answer this?
Yeah.
Okay, so do justice to Jen.
Hi, Jen. For pelvic ultrasound, you're concentrating on the reproductive organs, as we've mentioned. And for the abdominal scan, you're concentrating on other organs. You're concentrating on the liver, on the spleen, on the kidneys, both the right and the left. We are concentrating on the gallbladder. Yeah, so there is a difference between the abdominal and the pelvic scan. For the pelvic, it's majorly the reproductive organs. For the abdominal, it's other organs that are on the upper abdomen. Yes.
Okay. So concerning fertility, concerning reproduction, she emphasizes the pelvic ultrasound. Concerning other organs, other diagnostics, it is the abdominal ultrasound.
Yes.
I think that is quality information for our viewers.
Yeah.
Because you can end up mixing the things and then you miss out on, what you should do right now. All right, so many questions. Today we have Lily. Lily says, do we need an ultrasound even if they feel fine in pregnancy?
Yes, we really need an ultrasound even if they feel fine, because we cannot assess by your feelings. We cannot assess by the physical or what is presented on the outside. You can feel fine, yes, but the amount of amniotic is not enough. Or you can feel fine, yes, from the outside, but you're having maybe, let's say, a hydrocephalus. That's a case where the baby is presenting with a big head and the body is small. So yes, you really need the scan to be able to know. It's good to feel fine on the outside, but it's also good to confirm that you're really feeling fine on the inside. So yes, it's important for the scan.
The scan is very key.
Yes, very important.
Okay. I think that one should tie into helping other people, because there are people here who would wonder, the doctors say you have a small baby. What does that mean?
A small baby.
Yes, a small baby. The
A
doctor
small
says,
baby.
because you've talked about now the big head.
Yes.
Yeah,
That's a
hydrocephalus.
condition. Yeah,
A
yeah.
condition. Now, what does it mean when someone has small baby? The doctors say you have a small baby.
Okay, that may be more on the weight, because baby we measure with their bigness or their smallness compared to the weight. As I said during the last episode, when you're having a baby with term, that is from above 37 weeks, and they are below 2 kgs, that's a small baby, because you need to give birth to a baby with at least 2 kgs, on the lower side 2 kgs. So a small baby at term, that definitely means that that baby is weighing less than 2 kgs. Yes.
Okay. I think that also answers the question for our anonymous. She did not specify. She said, what does it mean when the doctor says the baby is measuring small on ultrasound? All right. So for the questions, I know if we are to answer all of them today, we are going to have we should have another show, and it will collide with so many programs. But as you give your parting shots, help us understand what every woman should do proactively today to prevent all these other conditions you've talked about, and also maybe highlight some of the lifestyle behaviors they should adopt.
So for the many conditions we've talked about today, from the fibroids to the cysts to PIDs and all that, for women, you see, we deal with a lot of hormones for women. So some of the things, they are beyond our control. Like for fibroids or the cysts, these are things that just happen on their own. Like they are non-cancerous tumors that grow on their own. We do not want them to grow, but unfortunately they do for some. So it's important to keep in the checks, the routine checks in the hospital. You can just see a doctor for a general check. You can see a gynecologist. For the women who are struggling with conceiving, they can check in with a gynecologist. Or even if you're not struggling with conceiving and all that, you can just check in with a gynecologist to get checked, a routine check for your health, a wellness check, so that you can be able to see what are we dealing with. Once you know what you're dealing with, I think the doctor will give you a heads up on how to deal with it. Because for things that are beyond our control, we just leave them to the doctors and to God to take charge, because we cannot do them. And then also for some things that we can control, like PIDs, we should stick to what we have said. Have one partner, one sexual partner, concentrate on your hygiene, be alert and be very keen. Once you start seeing for ladies, you're having very abnormal discharge that is smelly, get to the doctor. Don't go over the counter to get medication. And then you can be keen on your menstruation. There are some people who have normalized that they have irregular menses and they feel it's okay. It's not okay to have the irregular menses, because it can graduate to something like infertility or struggling to conceive. So whether you're having irregular periods, when you're having periods that they come for long, maybe you're bleeding for 10 days or for 14 days straight, you need to check with the doctor. Or if you're having a family planning method that's making you to bleed throughout, you can check in with the doctor. You have a change of it, or you consider what your choices, because we've normalized things that are not normal. And then when you're having cramps that are very extreme, it's not normal to have such cramps. So just check in with the doctor, and don't assume that just because you're supposed to have cramps, they're supposed to be painful. So the main thing I can say, be keen with yourself as a lady, be keen with yourself as a man. Many of the things that the society has normalized, it's not normal. So in case you see anything that is a red flag, anything that is raising eyebrows, please visit the doctor and get help.
Please visit
the doctor
and get help.
Yes.
Thank you so much, Fiona, that is very elaborate, very detailed, and we could not get a better person to convey that. For our viewers, I want to appreciate you again for keeping it Faith Today Television. The keyword here is don't wait for a crisis. Check often, check early. Prevention is key. My name is Enock Kitondekijja, and you have been watching the Healthy You program. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.